नमस्ते बिटिया, हमेशा खुश रहो बिटिया। I am Dr. Bharat Sharma, Assistant Professor, Department of Pathology, Faculty of Homeopathic Sciences, JAYOTI VIDYAPEETH, Women's University, Jaipur. Today's topic is renal failure. Kidney failure or renal failure is when kidneys don't work as well as they should. The term kidney failure covers a lot of problems. These problems can result in kidney failure. Your kidney does not get enough blood through filter. Your kidney is hurt by a disease like high blood sugar, high blood pressure, glomerulonephritis, and polycystic kidney diseases. Kidney failure can be divided into two categories: acute kidney failure or chronic kidney failure. The type of renal failure is differentiated by the trend in the serum creatinine. Other factors that may help differentiate acute kidney failure from chronic kidney failure includes anemia and the kidney size on sonography, as chronic kidney diseases generally leads to anemia and small kidney size. The first is acute renal failure, also termed ARF. Acute renal failure is a syndrome characterized by rapid onset of renal dysfunctions, chiefly oliguria or anuria, and sudden increase in metabolic waste products in the blood with consequent development of uremia. Etiopathogenesis is the causes of acute renal failure may be classified as pre-renal, intra-renal, and post-renal in nature. First is pre-renal causes. These causes include inadequate cardiac output and hypovolemia or vascular diseases causing reduced perfusion of the kidneys. Intrarenal causes are these include vascular diseases of the arteries and arterioles within the kidney, diseases of glomeruli, acute tubular necrosis due to ischemia, or the effect of a nephrotoxin, acute tubulointerstitial nephritis, and pyelonephritis. Post-renal causes. Post-renal diseases is characteristically caused by obstruction to the flow of urine anywhere along the renal tract distal to the opening of collecting ducts. Clinical features. The clinical features will depend to a large extent on the underlying causes of acute renal failure and on the stage of the disease at which the patient presents. However, one of the following three major patterns usually emerges. First is syndrome of acute nephritis. The characteristic features are mild proteinuria, hematu- hematuria, edema, and mild hypertension. Syndrome accompanied tubular pathology. When the ARF is caused by destruction of the tubular cells of the nephron, as occur in acute tubular necrosis, the disease typically progress through three characteristic stages from oliguria to diuresis to recovery. Third is prerenal syndrome. Typically, this pattern is seen in marginal ischemia caused by renal arterial obstruction, hypovolemia, hypotension, or cardiac insufficiency. Due to depressed renal blood flow, there is decrease in glomerular filtration rate causing oliguria, azotemia, and possible fluid retention and edema. Chronic renal failure. Chronic renal failure is a syndrome characterized by progressive and irreversible deterioration of renal function due to slow destruction of renal parenchyma, eventually terminating in death when sufficient number of nephrons has been damaged. Etiopathogenesis. All chronic nephropathies can lead to chronic renal failure. The disease leading to chronic renal failure can generally be classified into two major groups. First is disease causing glomerular pathology. A number of glomerular disease associated with chronic renal failure have their pathogenesis in immune mechanism. Glomerular destruction results in changes in filtration process and leads to development of the nephrotic syndrome characterized by proteinuria, hypoalbuminemia, and edema. The important example of chronic glomerular disease causing chronic renal failure are covered into two headings. First is primary glomerular pathology. The major causes of chronic renal failure is chronic glomerulonephritis, usually initiated by various types of glomerulonephritis, such as membranous glomerulonephritis, membranoproliferative glomerulonephritis, lipoid nephrosis, and anti-glomerular basement membrane nephritis. Second is systemic glomerular pathology. Certain conditions originate outside the renal system but induce changes in the nephrons secondarily. Major examples of this type are systemic lupus erythematosus, serum sickness nephritis, and diabetic nephropathy. Diseases causing tubulointerstitial pathology. Tubulointerstitial diseases can be categorized according to initiating etiology into four groups. First is vascular cause. Long-standing primary or essential hypertension produces characteristic changes in renal arteries and arterioles, referred to as nephrosclerosis. Infectious causes, a good example of chronic renal infection, causes chronic renal failure in chronic pyelonephritis. Toxic causes are some toxic substance induce slow tubular injury, eventually culminating in chronic renal failure. The most common example is intake of high dose of analgesic such as phenacetin, aspirin, and acetaminophen. Chronic analgesic nephritis, obstructive causes. The example of this type of chronic injury are stones, blood clots, tumors, strictures, and enlarged prostate. Regardless of the initial cause, CRF evolves progressively through four stages. Decreased renal reserves. At this stage, damage to renal parenchyma is marginal and the kidney remain functional. The GFR is about 50% of normal. BUN and creatinine values are normal. Renal insufficiency. At this stage, about 75% of functional renal parenchyma has been destroyed. The glomerular filtration rate is about 25% of normal, accompanied by elevation in by- byproducts of nitrogen and serum creatinine. Renal failure. At this stage, about 90% of the functional renal tissue has been destroyed. The glomerular filtration rate is approximately 10% of normal. Tubular cells are essentially non-functional. End-stage kidney or the glomerular filtration rate at this stage is less than 5% of normal and result in complex clinical picture of uremic syndrome with progressive primary and secondary systemic symptoms. Clinical features. Clinical manifestation of full-blown chronic renal failure culminating in uremic syndrome are described under two main headings. First is primary uremic manifestation, where primary symptoms of uremia develops when there is slow and progressive deterioration of renal functions. The result imbalance cause the following manifestation. First is metabolic acidosis, hyperkalemia, sodium and water imbalance, hyperuricemia, and azotemia. Secondary uremic or extrarenal manifestations are anemia, interglomerulary system, cardiovascular system, respiratory system, digestive system, skeletal system, which have osteomyelitis and osteoitis fibrosa. Summary: renal disease, irrespective of cause, usually results in acute renal failure and chronic renal failure. Acute renal failure may result from pre-renal, intrarenal, and post-renal cause. Clinically, acute renal failure, depending upon the stage, may result in syndrome of acute nephritis or syndrome of tubular pathology. Chronic renal failure is characterized by progressive and irreversible deterioration of renal function due to slow destruction of renal parenchyma, eventually terminating in death. Chronic renal failure may be caused by disease of glomeruli or tubulointerstitium. Clinically, CRF has uremic manifestation. These may be primary or secondary and involve multiple organ systems. This session is powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you all enjoy this session. If you have any query, please mention it comment box. Thank you.